We are now live. Okay. Hi everyone. Today we'll be hosting Rachel Dexter. Rachel Dexter is a communication expert. She's helped IMGs for a very long time to adapt and thrive in the NHS, specifically helping IMGs understand, how communication is in the British style. As we are all aware, communication is different all over the world. And for instance, the French can be very direct, Nigerians can be very loud, and that's normal. The British can be very indirect and polite. And all of these in a clinical setting can really help, your practice or harm your practice. And so Rachel has been working with IMGs for 12 years. And I understand you've lived abroad and in Europe, I believe in Denmark, how the communication style is different from the way it is here. So Rachel has kindly accepted to come, and have a talk and help and support this community. Rachel also have a channel and a page and a support resources called Healthy English. So I'm going to allow Rachel to introduce herself, and I'll stop talking now. Rachel, welcome to the Make It Make Sense series.
Thank you very much, and thank you for having me. It's an absolute pleasure to be here and to just be sharing some insights today that hopefully will be helpful. But I just want to start with, you've given me a lovely little introduction there. I just want to start with, just expanding on that a little bit for those of you that perhaps aren't familiar with my work with IMGs. I'm Rachel Dexter. I'm an occupational therapist, so I qualified back in 2005, and I've been practicing in the NHS with some gaps, but I've done about 15 years of practice in the NHS. I didn't go straight into OT, so I had a bit of a different journey that took me to different places, and at various points in my life, as Jonathan has mentioned, I did live abroad. So I've spent probably about a year and a half of my life in various parts of Africa. And as you can see from the pictures, doing things that perhaps I wouldn't usually do in the UK. And so I certainly have some experience of stepping out of my comfort zone and implementing skills in a completely different culture with completely different communication styles. And also, in 2018, I moved out to Denmark. My husband got a job out in Denmark, and we moved as a family. We lived there for 5 years. And I couldn't practice as an occupational therapist in Denmark. I didn't speak Danish. And I think it's a really helpful experience to step outside your own culture. Like for me, it was really helpful because all our friends in Denmark were from all around the world. And it started to help me realize what things about British people can be confusing. And we are really quite confusing. Sometimes the way we express things, the phrases we use, sometimes even the simple things like our greetings, when I was saying you all right to people, our communication style, sense of humor, lots of different elements that can cause confusion. And I think that got me really interested in looking into the experiences for doctors like yourself who have made the transition to UK practice to find out what was your experience? How was that adjustment? And I started having lots of conversations with lots of doctors. I listened to lots and lots of stories. I saw quite a few tears. And what became very evident very early on was that actually, once you've been through all the immense challenges of getting your license to practice in the UK, which, as you know, comes with lots of challenges, that when you actually come and you step foot in your first job, you also then kind of experience a whole new raft of challenges, not just the challenges that come with moving to a different country and getting used to a new system, but actually what does it mean to practice your amazing skills and knowledge in a completely different culture where perhaps different things are valued and people communicate in a different way and their expectations are different and teams work differently. And so I founded Healthy English in 2018. I've been working with international doctors and health professionals ever since, alongside my NHS role. And I've just become very, very passionate about trying to fill the gap that doesn't seem to be addressed elsewhere, about understanding those kind of unwritten cultural elements of what it means to practice. And I think a lot of misunderstandings, a lot of challenges stem from these kind of issues. So I've, since kind of 2018, I've done lots of things. I've done one-to-one coaching. I've developed online courses, lots of resources. I've spoken at conferences. I've partnered, and I'm partnering with a number of different NHS trusts to support their international doctors. And there's lots of topics that I teach on and train on, from colloquial language to regional accents to social conversations to conflict to breaking bad news to building rapport, British culture and traditions, and many, many other topics. But the topic that I want to talk with you about today is what I believe is really the important place to start when we're looking at moving forward and thriving within British culture. And I believe this is the most important starting point. And it's looking at communication style and applying what does it mean to apply your skills as a doctor in a culture where the communication style is very different. So in this session, we're going to consider two different communication styles. We're going to reflect on culture and communication. We're going to look at some of the common misunderstandings that can often result when communication styles come together. And then I'm going to share with you some simple strategies to start to think about how can you adapt your communication style? How can you make some adaptations to take on board these insights and to improve your communication? And then at the end, I'm going to just share with you an opportunity. If you like what you hear today, if you find it helpful and you think it would be really helpful to have further guidance and further training, then I've got an opportunity for further support that I will finish talking with before I take questions. So that's where we're heading with the session. So direct versus indirect communication styles. So these are kind of the two main communication styles. And I'm going to talk through each style. And I want you to be thinking, which style do I relate to? So thinking about your home culture, what is the style that I can most relate to in terms of what I grew up with, what was valued in my home culture? So first, we have direct communication styles. Now, in a culture where direct communication is valued, the intention when we speak is to make the message of the person speaking very, very clear. So it's clarity. So people say exactly what they mean, usually with quite a blunt, direct tone of voice. And the priority here is to be unambiguous. Yeah, it makes sense. Communication is about sending a message. The priority here is about clarity, taking away any any kind of element of being ambiguous, and making sure that people clearly understand what you mean. So, there's huge advantages to this communication style because there's not a lot of room for misinterpretation, okay, because it's usually a very clear message. Now, on the other side, we have indirect communication styles. Now, the priority here, or the main priority, is different. So with an indirect communication style, there's a tendency to hide or camouflage the true intention. So there tends to be a use of subtle differences in tone to convey different meaning. So often a person might say one thing, but implies another meaning. Now, the priority is, and that sounds a bit confusing, like why would people do that? But the priority is different with to a direct communication style. The priority here is primarily to maintain harmony, to avoid conflict and offense or embarrassment. So the politeness here is seen as more important than being clear and truthful. So we have a very different underlying priority here when it comes to an indirect communication style. Now, it's useful to kind of stop and consider, right, well, which style can I relate to? Which style have I grown up with that is valued in my home country? Which style is it that I'm used to communicating when I was practicing in my home country? Now, in my experience of working with IMGs, most people come from cultures where more direct communication styles are favoured. Now, in Britain, if you've lived here any length of time, you will already know that in Britain, an indirect communication style is generally the communication style that is prioritised and valued. Now, it's not that one style is necessarily better than the other. They're different. Their priorities are different. There's probably disadvantages and advantages to both styles. The problem is when two different styles come together and they're not understood. So there's a clash of cultures. So that's where the issues can come. Because a statement in an indirect style may seem confusing, unclear, evasive, or suspicious to somebody from a cultural background that favours direct communication. On the flip side, so vice versa, cultures that prefer indirect communication styles might misinterpret some direct statements as rude or self-centered or uncaring or bossy. So you can see here why two communication styles coming together can end up causing problems when we're not aware and understanding of each other's communication style. And I'm going to share just some examples to get you thinking about how this clash might manifest. Now, you may well be able to relate to some of these examples. You may well be able to think of your own examples of where you've experienced this. So let's look at an example between a doctor and a nurse. So a doctor gives direct instructions to a nurse and leaves. Now, he thinks he's been clear and unambiguous, which is important. The nurse thinks the doctor is rude and bossy and decides she dislikes the new doctor. The relationship has broken down. So next time the doctor comes on the ward, he doesn't understand why the nurses seem to be targeting him and rude to him, and the situation escalates. So this is quite a common situation from experiences that I've heard about, where the doctor has no idea what they've done wrong. All they've done is they've communicated an instruction in a direct style. What they don't realise is that directness has been misinterpreted as bossy, rude, and that is why in this situation a relationship could break down there. So that's an example between like MDT members. What about doctor and patient? How might this clash manifest? And there's lots of different ways that it can manifest, but this is an example. So imagine a patient has been listening to an explanation by the doctor. Now at the end, the doctor asks if they've understood everything. The patient has lots of questions, but thinks the doctor might be busy. It's their own fault they haven't listened properly, and it'd be unfair to delay the busy doctor. So they say yes. So the doctor finishes the discussion, satisfied that the patient is clear. The patient leaves with lots of questions that they try to find answers to on Google. So again, here we have a doctor that's used to a direct style, unambiguous communication. So when the patient says yes, they understand, they take it at face value in the literal sense, and they think this patient's understood everything. The patient is reserved, polite, doesn't want to bother the doctor, doesn't want to be a bother, and just says yes, that they've understood, even though they haven't. Now, again, I had a similar example to this recently at my work. So at the minute we have a physio from Nigeria that is joining our team, and I was asked to observe him doing an assessment and give him some feedback. And we went to see this patient who was very hard of hearing, and her daughter was there as well. And I was watching this physio communicate with the patient. Now, he kept saying, he kept asking, do you understand? And she was saying yes. And I could tell very clearly that this patient was not hearing what he was saying. And the daughter kept jumping in and saying, Mum, are you sure? Did you really hear? And she'd say, no, I didn't. And she'd say, you need to tell the physio when you haven't heard. But the physio was kind of just misinterpreting her yeses as a blanket, yes, they understand. Okay, so we need to start kind of understanding how these things can manifest. And don't worry, we're going to be talking later about how we can make sure we can understand patients better. But let's just look at one more example where it might manifest. And this is one that you may well relate to, between a supervisor and a doctor. So your supervisor speaks to you after a ward round where they observed you taking history of a patient. Your supervisor tells you that next time you might want to consider asking more details about their home circumstances. Your supervisor leaves thinking they've given you important advice that you will now adopt into your practice. The doctor considers what the supervisor said as a suggestion, but next time does not ask about home circumstances, feeling it isn't important. The supervisor then pulls the doctor up on it and asks why they haven't done what they said. The supervisor begins to be concerned that this doctor is not open to training and instruction. So what are the issues here? This may well be something that you've come across. Often, again, remember that priority in an indirect communication style is about avoiding embarrassment, avoiding conflict, politeness. And so often feedback is delivered in a way that isn't massively clear. You know, it's like, you might want to consider doing this. It might be a good idea to. So it's phrased as an option. And if you've come from a direct communication style, you're going to take that in its literal sense. But the problem is that the supervisor thinks that they've given a direct instruction and that it will be understood as a direct instruction, and then doesn't understand when they haven't done what they asked. So I just wanted to share some different scenarios to start to get you to think about the different ways that this clash of communication styles can cause issues in relationships and in communication. So understanding the issue is great. It's a starting point, isn't it? But how can we adapt? So how can you take this information and start to adapt? And sometimes it's just simple things that can make a huge difference. And the first key thing to consider is softening of communication. Now, I don't know if any of you uses fabric softener when you do washing, or whether you even do washing. But what does fabric softener do when you add it to your washing? What's the job of fabric softener? Well, the job is to make the clothes fluffy and comfortable and smell nice and feel nice. And that's why we add it to the laundry. Now, it's the same with communication. In Britain, where there's an indirect, kind of very polite communication style, words and phrases are added to make our communication kind of warm and fluffy and land more comfortably. So I like to think of it as the fabric conditioner of communication. We add these words and terms to make our communication less abrasive, less direct. And there's a funny cartoon that can help illustrate this point. So this is Get Around in English, how to be polite. So we've got like the wrong way of doing things. We've got this guy who's drowning in the Thames and he's shouting help, very direct. And you've got this British man in a bowler hat walking away. And, you know, he's like, I'm not going to help this gentleman. You know, he's been very rude, shouting help at me. And then we have the right way to do things. We have the guy drowning in the Thames, but he's smiling. And he says, excuse me, sir, I'm terribly sorry to bother you, but I wonder if you'd mind helping me a moment, as long as it's no trouble. And of course, now this British gentleman is very happy to throw in the life ring. Now, obviously, this is humor. This is an exaggeration. Please, if you're drowning in any type of water, scream help. That's totally appropriate. In emergency situations, obviously, we need to be direct. Clarity is very important. So I'm not talking about those kind of scenarios, like when a patient is crashing, for example. However, in most other situations, this softening of communication is really important. And the reality is, and you may have experienced this yourself, that many international staff are misjudged as rude, bossy, and not a team player simply due to their directness. And patients too can get the wrong impression as well and misjudge you as uncaring, simply due to communication style. So it's really, really important to understand how things come across. All you're doing is applying a communication style that is highly valued in your home culture. So there's no reason why you would understand why it should cause a problem until we understand the differences in communication styles and what happens when they come together. So one really simple way when it comes to softening communication, we'll use the example of instructions. So when people give instructions, we use soft phrasing to soften it because we don't want to come across as rude and bossy. So we very rarely give very direct instructions unless we're in those kind of emergency critical situations. So British people often use an abundance of polite phrases and expressions in conversations. And you may well be able to think about listening to the way that people give instructions, and you can think of these examples. So we've got, the difference between pass me the notes versus could you just pass me the notes, please? Start hourly obs versus if you could start him on hourly obs, that would be great. Follow this up versus would it be okay just to follow this up? And then to a patient, get on the bed versus if you could just jump on the bed for me, please. Now, I'm just giving you examples of softening phrases. It's not that there's one perfect phrase that works, but it's the principle of making things less direct and more polite to kind of fit in with this communication style. Now, it may feel a bit frustrating to think, well, why do I need to add all these extra words to my instructions? But the reality is that when we don't, you're going to potentially cause a lot more problems along the way. People are going to be less forthcoming in helping you. It's going to affect teamwork. So sometimes, and I've had doctors experience who have gone away, changed the way they give instructions, and they've noticed a huge impact on their communication. So softening communication is really important. Try and reflect on the situations at work that you give instructions, that you have these kind of conversations, and do I need to maybe soften a little bit how I'm giving those instructions? Now, we've talked about politeness and softening of communication, but it's really important to understand that another way that our indirect communication style can manifest is in the use of understatements. Now, let's go back to our definition that we had at the beginning, our definition of indirect communication styles. So remember, the priority here is politeness. So often the person says one thing but implies another meaning. The politeness is seen as more important than being clear and truthful. Now, often understatements are a way that people will say one thing but imply another. So even in circumstances where patients come to see the GP, for example, being clear and truthful initially is not always the main priority, which sounds crazy, right? If somebody's unwell or they're concerned and they've made that appointment, you would think that people would walk in and be truthful straight away about how bad things are. But actually, you will probably, if you're a GP, you will have experienced patients coming in, you saying, how are things going, or how are you doing? And they'll say, yeah, good, thanks, or not too bad, or I'm fine, thanks, even though they're at the GPs. So understatements are a key way that often this indirect communication style plays out, and often how people might say something but mean another thing. So some of the understatements that you might hear, a bit, a little, quite, somewhat, a tad. Now, all these words in their literal sense are often, in a literal sense, mean a small amount. Okay, I don't know if you're familiar with the term a tad. I think it might be Scottish, I'm not sure, but they all mean a small amount. But
they would say a tad little bit.
Yeah, a tad little bit. Yeah, put two things together. Exactly. There's so many regional expressions, isn't there? So it's very confusing with all the different expressions that we use. But often these words are not used in their literal sense, and it's why. Why would people use these understatements, or why would people play things down, kind of make out as if things are less, not as bad as they actually are? And I think it's helpful to just have a bit of a understanding of where I think this comes from. You see, in British culture, people don't like to come across as too emotional or not coping. Right? There's a strong value placed on being calm and being able to cope. I don't think it's healthy at all, but it's what's kind of often valued. So people kind of go out of their way to come across as if they're not falling apart, they're not too stressed, they're going to remain calm. And I think some of this stems back to the messages that were given during the build-up to the Second World War. So I don't know if you've seen this, the keep calm and carry on. It's like you see it on mugs and T-shirts, and like if you go to the airport, you see it everywhere. Now, this was the message given out by the Ministry of Information to the British people during the Second World War. It was an appeal to the British people to keep calm and carry on. And you can see the lady there, she's drinking a cup of tea. you know, she's sat on a completely destroyed building, but she's got her hair up. She's going to do some work. She's just having a break, and she's fine. She's going to keep calm and carry on. Now, the kind of this message was resurrected in 2000 when an old poster was found from the war. But there was a sense of putting your head down, not making a fuss, getting on with things. And it was an appeal to the British people to maintain their resolve in the face of an impending crisis. Another message that was also given out at the time was your courage, your cheerfulness, your resolution will bring us victory. So there was this idea that people needed to remain calm, even though this terrible thing was happening. And people were implored and encouraged to keep calm. And this is the way that we're going to win the war. So there was a real strong value placed on this. And I think that still filters through, particularly amongst the older generations. I do think things are changing with the younger generations, but particularly with the older generations, there's still a big kind of value placed on not making a fuss. I'm just going to keep calm. I'll go to the doctor when I'm literally dying, but I'm just, don't make a fuss. I'm not going to bother them. My mum's a terrible example of this. So that's why you don't often see a lot of public displays of emotion. Grief is often kept very private. And when people have lots of difficult life situations going on, people aren't quick to kind of show that. They want to show that they're kind of keeping calm and that they're not, they're coping with it. And I think another thing that demonstrates this idea of this kind of how British culture doesn't value this big display of emotion can be seen in the British actress Kate Winslet. I don't know if you're familiar with her. She was in Titanic with Leonardo DiCaprio, very, very famous film. But there's this emphasis placed on not coming across too emotional, too earnest, or too excited. We like people that are just calm. So Kate Winslet kind of doesn't really fit that mold. So she's known for very emotional speeches at the Oscars. So when she's gone up to accept an award, she starts crying and she gives these really emotional speeches. Now, how do you think the British press responded to that? Bearing in mind what we've talked about. These were the kind of things that the British press said about it. So The Guardian said, this speech raises the occasional wave of nausea, swiftly followed by a rush of hands to eyes in order to block out the spectacle. The Independent said the speech would make a corpse wince with embarrassment. It's us, her loyal British fans, to whom she should apologise. We expect less of you, Kate, much less. And then The Mirror. If Kate Winslet ever did an acceptance speech that didn't involve a bit of dramatic breathing, looking overwhelmed, good amount of cheese, we'd be well disappointed, which is why this morning we are feeling positively not disappointed, because Kate has delivered again, thanks Kate Winslet. Noticed sarcasm there. So if we take the example of Kate, who kind of breaks this mold and she gets up and does really emotional speeches, British people do not respond very well to it. The press slate her. Now, if I asked you, how do you think the American press portrayed Kate Winslet? They absolutely loved her emotional speeches. Okay, very different perception. And so what I want you to understand is that, in British culture, people are often trying to make sure that they're not being like Kate Winslet. Yeah, they're keeping calm. They're not too emotional. They're not too overexcited. They're not too using big adjectives and big emotions. You can see it also if you look back to the funeral of Princess Diana and you look at Prince William and Prince Harry, who were very young during that funeral. I don't know if you saw it or you've seen clips of it. And they have to do this really long walk behind the coffin. And then they have to sit through this service that the whole nation is watching. And they were praised for being calm and not crying too much and like putting their head down and carrying on as if it was a really positive thing. And the British public loved them for that, even though really it's quite unhealthy, isn't it? So it's helpful to understand this because it helps you to understand perhaps why your British patients will play things down and not be completely honest about how bad things are. So we need to be bearing that in mind. Now, there is circumstances where we are okay to get emotional, where it's culturally acceptable to get emotional, and those are usually things like sporting events. Now, it all goes out the window at a football match. People hug each other and cry and laugh and sing. It's completely different. And those scenarios, yeah, culturally it's acceptable to be like that. But when it comes to our own lives and our own circumstances and situations, it's not. And there's some really famous examples of these understatements that I'm talking about. So this is a quote from Brigadier Thomas Brodie in 1951. Now, he was part of the 1st Battalion, the Gloucestershire Regiment, in the Korean War. And there were 650 soldiers in this battalion. And they were confronted with as many as 10,000 Chinese soldiers. There's 650 of them against 10,000 Chinese soldiers. And he wrote in his journal, a bit sticky. Things are pretty sticky down there. Now, if you're not familiar with the term sticky in this context, we use the word sticky to describe a difficult situation. If you think about trying to walk through sticky treacle, it's not easy. Now, things were more than a bit sticky. They were absolutely dire. They were probably going to die. Another great example, this is a British pilot Eric Moody, who was piloting a BA flight in 1982 from London to Auckland. And they got caught in a volcanic ash cloud and all 4 engines failed. Now, they did go on to land safely, I'm pleased to say. But he came on the tannoy and said, ladies and gentlemen, this is your captain speaking. We have a small problem. All 4 engines have stopped. We are doing our damnedest to get them going again. I trust you're not in too much distress. And the last example, this is one that I saw in my local newspaper when I lived in Sheffield. Now, if you actually spend some time looking through news articles or in the newspaper or news sites, and kind of look at people that are interviewed, you will see lots and lots of use of understatements. Now, this was a tragic situation that happened. It was terrible. A guy went into this house with a machete, killed the mum, killed 2 children, plus another child that was on a sleepover. Like, it was absolutely horrific. And this is what a neighbour who lived on that street said when they were interviewed. It's a bit too close. I know about the ages of the kids and they're not very old. It's quite sad. Now, if that isn't an understatement, I don't know what is. I mean, but what I want you to understand is that doesn't mean that that person literally thinks it's just quite sad. Obviously, they think it's horrific. They think it's awful. But they're not going to use those kind of big emotional adjectives when they describe things. It's not how we generally talk. So having gone through all of that and kind of understanding it a bit, how might this manifest in patient interactions? It's great to understand it, right? But so what, right? So when you're seeing patients, what are the kind of things you might hear patients say? I've got a bit of discomfort in my back. I've been feeling a tad under the weather. I've been feeling a little low lately. I had a little mishap and twisted my ankle when actually they tripped over a flower pot and broke it in 3 places. I've had a few minor issues with the medication, you know, when they've got terrible headaches and they can't sleep. What about this one? I'm sure it's nothing, but while I'm here. Yeah, your elderly patient just says that, mentions it before they're about to leave, probably pretty serious. So these are some of the examples that you might come across. What about colleague examples? You need to be a little faster with your patients. Do they mean a little? You might want to work a little bit on your history taking. It's been a bit busy today. Probably mean exactly the opposite. I was a bit frustrated when he didn't offer to help at all. I admit I was a tad stressed when the relatives started shouting. These are some of the examples that you might come across, and you can probably think of examples that you've experienced yourself. Now, remember, the general priority here is to maintain harmony, avoid conflict, offence, or embarrassment. Now, there are certain contexts where British people do use overstatements. So generally, we don't like to come across too earnest, too emotional, too excited. But there are circumstances where it is culturally acceptable to be like that. And it's usually in the minor inconveniences of life. Now, this is a funny illustration to demonstrate what I'm saying here. This is Very British Problems. Now, I always recommend Very British Problems. It's such a fantastic way to learn about British culture, the phrases we use, silly things that we do, and the history behind it. You can follow him on Facebook, YouTube, Twitter. But if you go onto YouTube, they also made a TV series, which you can watch episodes from YouTube. Just type in Very British Problems. It is so interesting, helpful, funny, and it goes into all the kind of history behind why British people kind of react in certain ways or say certain things. It's really insightful. So this is his comment to illustrate the point. It's a bloody nightmare, meaning something is proving a mild inconvenience, typically used to describe slightly heavy traffic or the internet not working, because it's culturally acceptable to be really annoyed about those things. It's not ideal, meaning something terrible has happened and life is almost certainly ruined. So he uses humor to bring out the kind of craziness of how we communicate in our indirect style. So you may well hear people say, traffic was an absolute nightmare. It's absolutely pouring outside. I got completely drenched. I'm so starving I could eat a horse. It took me hours to queue for lunch. I got absolutely smashed last night, which is a slang term for drunk too much alcohol. Or about pets. That dog is the cutest thing I've ever seen. She's so adorable. I just want to eat her. So it's not that British people don't use these big adjectives and don't get excited or kind of use overstatements, but you can see the context I'm talking about, the ones that are socially acceptable. So as long as they aren't in the context that is going to suggest that we're not keeping calm in the face of adversity, in those trivial matters, they're very happy to use overstatements. So bearing all this in mind, how can you adapt? So if people often use understatements where we can't trust the literal meaning of the words, if people's priority here is not necessarily to speak, to tell you clearly what they mean, but to be polite or avoid conflict or to keep harmony or to show that we're being, we're not we're not coping, how can we adapt to make sure we understand our patients? And I think the answer is to listen with your eyes, which sounds strange because you can't see with your ears. But what do I mean by this when I say listen with your eyes? The reality is that the most important thing in communication is hearing what isn't being said. Now, if you actually break down what communication is, only 7 to 30% of what we actually communicate is what we say, the words we use, that verbal communication. So the research varies, but they all agree that somewhere between 7 and 30% is the verbal communication, which leaves 70 to 93% of what we communicate non-verbal. Now, I think in a culture like Britain, where the communication style favours an indirect communication style, you're going to be more at the 93% of communication being non-verbal. The most powerful message that you're going to give to your patients and colleagues, and the most powerful message that you're going to get from them is through the non-verbal communication, which is why I spend a lot of my work with international doctors, helping them realise that actually you can work on, if you feel like your English needs work, you can work on grammar and sentence structure and vocab, but actually if you neglect the non-verbal communication, then you're neglecting the most powerful part. And I think that could be an encouragement as well. So we have to be looking at the two. And if they don't match, we need to be listening to the non-verbal communication, not the words. Now, if we break down non-verbal communication, we have these different elements. We have tone of voice, we have eye contact, facial expressions, gestures, positioning, posture, and touch. These are the kind of main areas of non-verbal communication. Now, I think some aspects of these are kind of valued similar across cultures. Other aspects can be interpreted very differently. So take eye contact, for example. In some cultures, direct eye contact in certain contexts would be disrespectful. So maybe to your elder. For a lot of doctors in their home countries, they would not give direct eye contact to their seniors, to their consultants. They would look down and maybe stand up when they come in the room, which can be a shock when we're not like that in the UK. In eye contact, it's always associated with engagement and listening and caring. So if you didn't give good eye contact with a patient or a colleague, it would be misinterpreted as you're not listening, you're not engaged. So some things, there are cultural differences with these non-verbal elements. And I want to just go through a few of these elements in a bit more detail. So tone of voice. Tone of voice is so important when you're listening to your patients and colleagues within an indirect communication style, because those subtle differences in tone of voice will be telling you whether you haven't got a clear picture of what's going on, whether you need to ask more questions. You know, it's not, again, it's not what we say, it's how we say it. You know, when I say to I've got 2 sons, and I say, you need to go and say sorry to your brother, and they go and say, oh, sorry. Well, they've said the word sorry, but it doesn't mean anything, does it? Because the tone of voice is not a sorry tone of voice. There's a big difference between sorry and sorry. Yeah. So people rely heavily on tone of voice to detect whether people are being humorous, whether they're making an understatement, and to help determine what people are really trying to communicate, which is why written communication can be a real challenge, because we don't have that. We often project our own tone of voice onto it. Now, our tone of voice can communicate many different things: warmth, friendliness, compassion, pain, frustration, anger, disbelief, annoyance. So we also have to be careful about our own tone of voice, because we can say all the right words, but if your tone of voice doesn't match it, that's what the patient's going to listen to. Again, very British problems takes on this kind of theme of tone of voice. They've got this statement: how's your day going? Not too bad. Now, not too bad is a kind of really standard answer, isn't it? We all tend to say, what, you know, not too bad. And he's picking out the fact that depending on tone of voice, you can mean so many different things. Not too bad can mean surprisingly okay so far. Worst day of my life. It's going spectacularly. It's exceedingly unremarkable. I feel nothing. Because the difference between saying not too bad and not too bad are completely different. Yeah. So tone of voice, really, really important. So think about, you know, what kind of, because tone of voice is going to tell you information about pain, about mood, about frustration, confusion. We need to be tuning into tone of voice. Eye contact as well. What are we looking out for when we are considering eye contact? Well, I've already said that in British culture, eye contact is always valued. It shows that we're listening and engaged. So if you have a patient that is not giving you good eye contact, there's going to be a reason for it. Now, I know there are obviously some people who are neurodiverse that aren't good at eye contact, and that can be a reason. But if a patient is avoiding eye contact, it may well mean that they feel uncomfortable, they feel anxious, they're withdrawn, they're low in mood. So again, we need to be curious and asking questions. What clues can we get from facial expressions? Is a patient smiling? Have they got a completely unchanging expression as we're explaining something? Are they wincing? Someone can be using an understatement to describe their pain, but it's very difficult to hide that true level of pain in somebody's facial expression. Now, and my mum was, again, an example of this. She had a really bad hip. She needed a hip replacement. And I would say, Mum, how's your pain? She'd say, oh, not too bad. And then I'd watch her get up from the chair and like wince and kind of limp. And I'm like, I think when you say not too bad, you mean it's excruciating. If you're explaining something to a patient that they need to understand, there's a big difference between a patient that is looking at you, nodding, smiling, to a patient that is just staring at you with an unchanging expression. Now, both those patients at the end might tell you, yes, they understood, but the one that's not been nodding and smiling and kind of had a slight frowned expression, we're going to want to question that. Are you sure you understand? What about positioning and posture? What we can be looking out for? Is your patient hunched over? Are they slumped? Have they got a closed posture? Have they got an open posture? Are they holding themselves? Are they limping? Positioning and posture gives us lots of information about the true experience for people. So we're just going to go through 3 examples just to kind of finish. So let's go back to that example. You're explaining something to a patient, and you've given them an explanation, and they've been kind of staring at you, and they've not been nodding along. And you ask them, is everything clear? And they say yes. Now, we want to be a bit suspicious about whether they really are clear, because they've not been showing that nonverbal communication, that they're engaged, they're listening, they're nodding. So we might want to ask them a second time. Are you sure everything's clear? I know it's a lot to take in. I'm very happy to answer questions. You want to make sure that they know you're ready and willing to explain or answer any questions, because we're fighting against that politeness. So I don't want to bother them. You know, it's sometimes saying, have you got any questions? Is sometimes we can phrase it in a more helpful way. We say, what questions do you have for me? Because that's a more kind of invitation to ask questions. And if they still say they're fine, it might be informing them of what to do if they think of any questions. If you do think of anything, write them down, and when we meet next, we can speak to them, or you can direct them to information. What about a patient that says the pain is not too bad? They've said, you know, the pain's not too bad, but they're holding themselves, they've got a pained expression. What could we do to help get a clearer picture of what this patient's experience is? Well, we can use open questions. Can you tell me a bit more about your pain? How's it been impacting you? We can look at the things that can be impacted by pain. We can use a pain scale. That can be a helpful tool. And we can challenge them as well. If we're not seeing, if the nonverbal communication is not matching what they're saying, we can challenge them. You said the pain wasn't too bad, but it looks to me like you're in quite a bit of pain. All right, so we need to have that curiosity. And finally, what about a gentleman who's in the GP surgery and they say, yeah, I've been feeling a little bit low since my father died. But they've hunched over, they're not giving you eye contact, they've got a monotone tone of voice. We're going to be suspicious, aren't we, that when they say they're feeling a little low, that they're using an understatement here. We want to use open questions. Can you tell me a bit more about how you've been feeling? We might want to use some questionnaires to help assess their mood, and perhaps to explore the areas that are often impacted by mood, like sleep, appetite, motivation. So it's about listening with our ears listening with our eyes as well as our ears, and showing curiosity when there's a mismatch, and asking more open questions and prompting them and giving them a space where they can be honest and open. So to understand your UK patients better, you need to be listening to both the verbal and the non-verbal messages, particularly in a culture like Britain, where the communication style is very, very indirect. So I hope that's a helpful starting point for you. I think communication style often underlies a lot of problems, a lot of things that are difficult to understand. Why am I struggling with this? Why is my communication a struggle? Why are my relationships a struggle? So hopefully that's been a helpful starting point. Now, I know that having a bit of training like this and going away doesn't just mean that you can kind of now everything's fine, you can go and get results. And so I just want to finish by offering an opportunity for further support and training if that's something that you think would be helpful for you. So I want to offer people here today the opportunity to join the NHS Success Pathway, which is my membership that I've designed after many years of working with doctors like yourself. I've designed this specifically for you. It's my exclusive membership. I've created this to help people like yourself overcome challenges in cross-cultural communication and practice, helping you to feel confident and apply your amazing knowledge and skills within the context of British and NHS culture. Now, at the moment, enrolment's closed. I only open it up to enrolment twice a year. But I'm opening up some spaces today just in case there is anybody that wants to take this opportunity to move forward with more support. Now, this is something you might want to consider for you if you live and work in the UK or planning to. If you want guidance applying your knowledge and skills in a completely different culture, if you want to avoid a lot of mistakes and misunderstandings, learning the hard way is not the best way to learn. And if you want to feel more confident, valued and respected in your career. So this is what the membership is aimed at helping you with. And there's lots included in this membership, and I'm just going to briefly go through what is included. So firstly, I do weekly live teaching sessions for my members through Zoom. And I record them as well so that the recordings are available. And I teach on all sorts of topics, from culture, communication, language, career skills, cultural traditions, festivals, and everything in between. So you get access to weekly live teaching sessions with me. You also get access to my online course. So I have a comprehensive online course that I developed after quite a long time coaching doctors one-to-one. It goes through all the foundations of what you need for practice in the UK, communication with your colleagues and patients. It's comprehensive, it's structured, and you get access to that as part of the membership, as well as access to my entire digital library. I have a lot of resources that I've developed over the years, a lot of short videos, a lot of downloadable resources and guides, and you get access to everything all organized for you in my app in topics. You also get exclusive WhatsApp community support. So I have a WhatsApp community that you can ask questions. I share things in that. I ask people questions. I share teaching schedules and meeting links in that WhatsApp community. And I also do an expression of the week, which is really fun. So every week I add a new expression, one that people often might not be familiar with, the kind of things that your patients and colleagues will say, what it means in example sentences. And that's just another great way to build up that cultural language. And finally, as part of the membership, everybody gets direct access to me over WhatsApp for asking questions, support and advice. So I get people messaging me saying, I've got this situation at work. Is it culturally appropriate for me to say this? Or what does this expression mean? And I love it when people ask me questions. So that's what the membership includes. You get all of that as part of the membership. So if you are somebody that thinks, do you know what, this might be helpful, then I'm opening up some spaces today to the membership. Now, it's usually £57 a month, but through the Academy, I've worked out a discount of £20 every month. So it'd just be £37 a month if you wanted to sign up at the discounted rate. And I do offer a 30-day money-back guarantee. Now, I don't ever want to be charging for something that isn't helpful. Like, the only reason that I do this membership is because of the feedback that I've got. So if you kind of joined and thought, do you know what, this isn't actually what I expected, or this isn't helpful, just email me. I'll give you your money back and cancel your membership. So I want you to have the opportunity to trial it if you think it might be helpful. If it isn't, that's absolutely fine. And there's absolutely no pressure to stay a member for any length of time. You can cancel any time. So you can see some of the reviews there. You can look on Trustpilot. This is what keeps me going. It's the feedback that I get. It's the difference that I hear that this kind of training and insights is making. It's why I'm passionate about what I do. So yeah, I just wanted to give that opportunity if people did want further support. So that is that's the end of my presentation, and I'd love to answer any questions about what I've been talking about or about the membership. Very, very happy to answer those questions. And I don't know if I put in the chat the link there as well, in case people did want to look into that membership.
Yes, please do. I think it'll be something a lot of the people listening will really find appreciative. I've tried to put some of the things while you were doing the presentation from some of the very British problems. But I think if you've got the link to the membership, that would be amazing.
Yeah, I have got it, and I'm just not sure where to put it. I'll put it in a private chat, which obviously isn't the right place. I don't know if you can see that. Jonathan, you can share it.
Yeah, I think, let me see. I've not got it.
Let me see if I can join the chat, and then I can
yes,
I can share it in the chat. Oh,
maybe email it to me, because
yeah,
I think the WhatsApp group would really be the place where people would find it most useful.
Yeah, that's fine. I'll email it to you now, and then maybe you can quickly share it.
Yes.
Yeah, I'm very, very happy to answer people's questions. I do love questions. I can't promise to always answer everything, but I love having questions.
And I think getting the opportunity to ask a question really when, there's something that is looking sticky is really just very useful, because then you can have an idea and clarify something.
Yeah.
And it can really influence the outcome of things. Yes, thanks. I'll just copy that now. Yep. Done. And
do you know what? I think I've managed to join the chat myself. That's exciting.
Amazing.
Oh,
So guys, if you have questions, type in the chat. If you have clarification, you can always email the questions to me. I think the membership is really something that would go a long way in helping. And the reason I say that is just beyond, living with neighbors. And sometimes it's useful to, while crash courses are good, this is good to have like real-time learning, and you can adjust this and you can adjust that. And I found one of the tricks I use, for instance. So when I do clinics, there's a trick I play, and I think it's so what I tend to do, because I know one of the things that can be quite sticky with patients is what time you want them to come back to clinic.
Okay. Yeah.
So I would make them feel like they're making the decision, and it's been amazing. And so they send chocolates and stuff. So I'll say, would you like to come see me again? Would you like for your GP to decide, or would you like us to, discharge you? Whatever you pick is absolutely fine. We're just going to facilitate that. And initially, when they're like, I'd like to come, then you find out, I don't want to come. So and then it's because, in real time, you're like, okay, Rachel said this, let me, and then you pay attention more. You pay attention, for instance, when you go into the room, like you read the room now, you look at posture, you look at the amount of eye contact, you listen to the tone, and just how, speaking. And so I think the membership is something I really would recommend. A few people have struggled, especially with their SCA, like I was saying to you, with the GP exams. And it's because the patients you will practice with and on would come from the community. So whether you are a surgeon or you are a physio or you are a GP, your patients wouldn't come from like professional aspects, and they would be everyday people, and they would joke in a British style for the most part, and then they would also expect that you have some skills, to make jokes in a British style. And so just in case because sometimes the patients will complain about, one of our consultants through us, but they'll say, I wouldn't like to bother you. They would say something else. Like maybe they may complain about the food, and when maybe what they really mean is, I'd like you guys to facilitate my discharge. And so, or they complain about the bed. So it's all about, training, interacting, things like this. I'd like to really thank you for, coming to talk to us. It's really very useful for our community. I'm sure a lot of people would sign up, and they would really find it useful. And people also need this for their PLAB exams, interacting at the supermarket. There's a lot of things that it applies to.
Yeah, it does. And, I've helped a lot of people through the SCA, through PLAB, through the different kind of fellowship exams that people have, really struggled with, often because of the communication elements, and it's understanding what they're looking for. And it's, it's the other thing that I do spend a lot of time supporting people with is more social conversations, because, a lot of international doctors are quite confident with professional conversations and the kind of terminology, but that more informal conversations, the social conversations, with colleagues as well as kind of patients, can be a real struggle. And then what happens is they often avoid it. So and then it's a vicious cycle, because they avoid those social situations, and that affects their confidence even more, and they get more anxious and they avoid it more, and it becomes like a negative cycle. So what I try and do is kind of break that cycle and give people confidence and really quite simple, effective strategies to be more responsive in social conversations, to handle unfamiliar topics, to be proactive in perhaps building up knowledge of popular culture. In fact, in the membership, I'm doing a whole series this month on popular culture and going into the different elements, because these are the things people are talking about. So the more you understand, the less isolated you're going to feel from those conversations. But also, actually, you don't need to understand everything to join in those conversations. So it's giving people ideas of how to build on those social connections, because those have a huge impact on professional relationships as well.
Yes, definitely. I think it's once it's socially smooth, it becomes professionally better, for sure.
Yeah, and you feel more settled. You know, it's not,
yes.
when you come to have to work in the UK, it's not just about a job. It's about, coming into the community. It's about establishing your life in the UK. It's more than just a job. So you want to build social connections and feel like a valued part of the team. And that's, that's what all my support is aimed at, for helping people to achieve.
Rachel, I can't thank you enough. I know you have a teaching to go to in about 1 minute. So I'm just going to just thank you and say if you have any last words for anyone.
Yeah, okay. So I think I just want to finish with an encouragement. And I share this story quite a bit. So when we lived in Denmark, my son was under health specialists, and our best experience in Denmark was with the specialist with the least amount of English. She really struggled, but she really struggled with the communication in English. We had to help her with the language. But it was our best experience, because through her nonverbal communication, it was very obvious that she cared about my son. She was going to do the best for him, and she was going to do everything she could to help him. Now, as parents, that was far more important than her being able to speak perfectly in English. And a lot of doctors that I work with, do worry that their English isn't good enough, and actually, you can have British doctors that are terrible communicators. And actually what people want more than anything is to be listened to be for care and for compassion. And so, you don't have to be perfect at a language. That's not the answer. That non-verbal communication, we need to be tuning in with the patients, but also think about what is my non-verbal communication communicating. And that is a really, really powerful thing. I can see somebody's just asked about how we get the discount. The specific link that I shared gives you the discount. So I don't know if you managed to share the link, Jonathan.
I believe I did.
I think you shared the general website link rather than the actual.
Oh yeah.
Okay. So that's my website link, but the actual link that I emailed you was the one for the discount.
Okay, so let me just pull that up again.
Because if you go through my website, it will show that it's closed and you have to join a waiting list.
That's this one, yeah. Oh no, I need to post it for you to see. Yep. Let's see.
Yeah, there we go.
That's the one. Yeah.
That's the link. So if you follow that link, that will that is the discounted link, and that's the one that you need.
Amazing, Rachel. Thank you.
Absolutely.
I wouldn't want to keep you any longer. I'm
Pleasure.
sure there's a lot more people that need your time. Thanks for coming.
Pleasure. Thanks for having me. Bye, everybody.
Bye. Thanks, guys. And that's the session with Rachel Dexter. Excellent teacher in British communication. Thanks, and please do share this. And most importantly, this video would be available live. If you've missed it, come back, watch it, take what's in there. There's a lot of useful information that can help you. Bye.